Surgical anatomy of cleft lip and cleft palate. Cleft lip and cleft palate are congenital malformations caused by incomplete fusion of facial structures during embryonic development. A comprehensive understanding of their surgical anatomy is essential for successful repair and functional restoration. Cleft lip anatomy. 1. Normal anatomy, lip structure. The lip consists of 3 layers: skin, muscle, orbicularis oris, and mucosa. Philtrum, formed by the fusion of medial nasal processes. Vermilion includes the red lip, which is continuous with the mucosa. Nasal anatomy. The columella and alar base provide nasal support. 2. Cleft lip anatomy. Types. Unilateral, affects one side of the lip, often extending into the nostril. Bilateral, affects both sides, leaving the central segment prolabium isolated. Anatomical disruption. Muscle. Orbicularis oris muscle is misaligned and discontinuous. Skin and mucosa. Separation along the cleft, often asymmetrical. Nasal deformities. Depressed alar base. Flattened nostril on the affected side. Blood supply. Primary blood supply is from the facial artery and its branches. Cleft palate anatomy. 1. Normal anatomy. Hard palate, composed of the palatine processes of the maxilla and horizontal plates of the palatine bones. Midline raphe indicates the fusion site. Soft palate, composed of muscles, e.g. levator veli palatini, tensor veli palatini, palatoglossus, ends with the uvula. 2. Cleft palate anatomy. Types. Complete, extends from the uvula through the soft and hard palate into the alveolus. Incomplete, partial cleft of the soft or hard palate. Anatomical disruption. Hard palate. Defects along the embryologic fusion lines of the maxillary and palatine processes. Soft palate. Muscles are misaligned and do not meet in the midline, impairing function. Levator veli palatini is abnormally attached to the posterior edge of the hard palate. Blood supply. Mainly from the greater palatine artery. Functional implications. Cleft lip. Difficulty with oral seal for feeding. Nasal airflow obstruction and aesthetic concerns. Inadequate separation of oral and nasal cavities. Issues with speech, velopharyngeal insufficiency, feeding, and hearing. Surgical considerations. Cleft lip repair. Key goals are realignment of the orbicularis oris, nasal symmetry, and aesthetic reconstruction. Techniques include Millard or Tennyson-Randall repairs. Cleft palate repair, aimed at functional restoration of speech and feeding. Techniques include pushback palatoplasty, Furlow-Z-plasty, and two-flap palatoplasty. Muscle reorientation, e.g. levator sling formation, is critical. A thorough understanding of the anatomical and functional disruptions is critical for optimizing surgical outcomes.